So, and we'll talk about some skincare stuff and the mineral-based makeup, and you know, we'll get that going. But the fun part that really helps kind of recontour the face as we age and everything are probably going to be the injectables.
Okay.
And some things are just no-brainers, like these little lines here, maybe some little lines at the edge of the eyes, and maybe even a few little lines on the forehead, because you may end up wearing your hair, sometimes more of your forehead may show, is that right, than others?
Yeah.
So we can get just all of those greatly reduced. And that's really easy. That's a no-brainer. That's the peanut butter and jelly of anti-aging. We can do that, you know, really nicely with that. And then as far as filler, adding volume, or either really smoothing out areas. So some areas down in here we can really smooth out, which gives the illusion of having a straighter jawline.
Okay.
So we may, for instance, even hold the mirror and let me show you. We may actually look straight ahead with no expression if you can. So here there's a little dip here that creates this. So we may actually come and put a little bit of filler right in here, so it creates the illusion of having a very straight jawline there.
Okay.
So we actually don't, this would be a surgical thing to get rid of that, where they would come over here and pull up like that. So we're not actually getting rid of this, but we're smoothing this area out, giving the illusion of it being very straight.
Okay.
And that would be done with a filler. Juvederm would be a smoothing filler that we would use there. And, you know, we may even smooth a little bit out around here as well. A little bit with these tiny little lines that are just starting to go vertical away from the lips. We can smooth those out a little bit. And it sounds like tiny little tweakings of things, which really it is, but the smallest little things end up making the big difference. You mentioned lashes. I mean, that's one of the things that, you know, you may not even think about. But when you have some eyelashes, it is automatically a youthful look. So it restores a little bit of that youthfulness. And your Wow makeup makeover comes with Latisse. So that would be what you would use to do lashes. 100% of the time it's worked. It's been out, I guess, about 3 years now, and I've used it that whole time. So if you heard anything about it or have any questions about it, I'll be glad to answer those. I've never seen anybody that didn't work on it, and that's hard to say. In medicine, you know, you usually do not say always or never, but this is one of those drugs that has always worked. So, yeah. And then Nicole Mitchell. Do you know Nicole?
I do not.
Okay. She is a very, very popular, very good hair artist now, hair designer. And so you have the opportunity to sit in her chair and give you some ideas and things and offer some things for you. And, of course, it'll always be up to you. But she's a professional, and she would be great
Exciting.
at her. I know. It's like, you know, TV makeover. So that's awesome. What I know for sure we'll do is we're going to do a little bit of Botox around on the upper face, and we'll probably end up doing a little bit of filler as well.
Okay.
Now, filler, there's a little greater risk of bruising with that. So we'll want to make sure that we do that at a good time, that you don't have something coming up and should you bruise a little bit.
Okay.
Botox, rarely do we have bruising with that. We need to tweak that occasionally, especially with a first-time injector. You've never been injected before. I've never injected you. So just to get your perfect dosage on that. So Botox is dosed according to individual needs, unlike antibiotics or something that, you know, everybody would take a certain amount. So I would start out with what I feel like is perfect for you based on the strength of your muscle and past experience of what's worked well. And if we need to tweak that a little bit, we'll do that in about 2 weeks. We can tweak that some.
Okay.